Hi there. This is a quick video with information on who should be referred to the Blind Babies Foundation. Many of the regions we serve are remote, and therefore we thought this would be an easy way to get you the information about who should be referred and when. We serve children and their families, children who are blind and visually impaired from ages 0 to 5. Most of our focus is on 0 to 3, and then we do follow as needed families up through the 5th year of life for the child. Our services are relationship based and in the natural environment. This means we focus on the entire family's ability to address the needs of the visual impairment, and that most of our services are provided in family homes. We also do collaborate with medical providers and other educational programs, providing medical and program visits. As far as referrals, always err on the side of making a referral if you have questions or concerns. As well, we do ask that even if you think a child has already been referred to the Early Start program in your area, that you go ahead and make the referral. It just makes sure that the child is served that much faster. We, because of our model, do not have to wait until the IFSP is in place or the IEP is in place. We can immediately contact the family and answer any concerns that they have. And so we do ask that you go ahead and send that referral through. There are two main groups of kids who should be referred to the Blind Babies Foundation for services. First, children who have a clear diagnosis should be immediately referred. Sometimes the doctor will have already referred, but go ahead and refer if you do not know, because again, we will process any duplicates and we'd rather get the referral. The most common pediatric diagnoses are cortical visual impairment, retinopathy of prematurity, optic nerve hypoplasia, albinism, optic nerve atrophy, and retinal diseases. By far, cortical visual impairment is the most common. It's probably likely the most underdiagnosed as well. And so we would then move to the second category of kids, which may be a little bit more difficult to identify, but hopefully this will give you some pointers. And that is kids who do not have a clear diagnosis. In many cases, this is because of the age. Sometimes families haven't even had a chance to get to the doctor, the eye doctor, much less to get a diagnosis. Sometimes even when they've seen a doctor, the child hasn't gotten a clear diagnosis for numerous reasons. And what we would ask is that if you feel, or the parent feels, that the child is not using vision in a typical manner, or often what we hear from parents is, I cannot tell what my child is seeing. I don't know what my child sees. These kinds of concerns are big red flags for referral. We find that parents and caregivers are excellent judges of whether a child is using typical vision or not. So go ahead and refer these kids. It could be a professional involved as well, a nurse, a PT, an OT, a pediatrician, anyone else, a teacher who is working in the home. Go ahead and make the referral, and then we will go through the steps of determining whether that's a child who actually needs services. And lastly, I would ask, please remember that our name, Blind Babies Foundation, is really not representative of who we serve in this era. It was when Blind Babies started 50 years ago. But at this point, many families think of blind as meaning their child cannot see. And in fact, the vast majority of our clients use vision for learning, use vision for moving about their environment, and in fact what we're talking about is a visual impairment that just causes them to see differently than typical vision. So it's important to keep that in mind when talking to families about Blind Babies Foundation. It can be off-putting and frightening to families. So if you don't mind just making sure they understand that we serve a wide range of visual abilities, that's very much appreciated. Thank you for your time. I hope this was helpful. Our referral number is here, 510-446-2229. Our website, www.blindbabies.org. Please call with any questions and referrals. Thank you.